Hello everyone. As per the series which we are going through regarding scope of each and every branch of MDS in India especially, let me introduce to one gem of a person, Dr. Aman Sachdev. I know him since more than a decade now. He was rank 1 in Karnataka State Entrance, All India ranker, and eminent orthodontist we have in Delhi. He's a certified Invisalign provider. He's doing whatnot cases at my clinic and many, many cases in Delhi-NCR. He's also teaching with us since the day he passed out, I think 2015, having experience of more than 9+ years now in the industry. And I vouch for him, like saying, my students know that I call him as one of the most intellectual guy in the dental world I know. Welcome, Dr. Aman. Thank you for giving your valuable time today for this session.
Thank you, sir.
Dr. Aman, मैंने जितना बोलना था बोल दिया. Now you have start talking on the branch of ortho. Starting
Hmm.
with कि ortho BDS level पे बहुत कम पता होता है. We hardly
Correct.
do cases. We do
Hmm.
wire bendings. We do removable little bit of appliances, but we study a lot. Like you also teach MDS
Hmm.
aspirants. You teach everything from growth and development to fixed appliance and everything. प्लीज एनलाइटन अस कि एक पीजी जो एक बीडीएस ग्रेजुएट जब एमडीएस ऑर्थोडोंटिक्स में एंटर करता है, what all spectrum of things you learn in
Hmm.
3 years of MDS if you are doing from a pretty good college?
So in BDS, we hardly learn anything which is related to clinical orthodontics. They just give us few appliances, Adam's class, finger spring, just bend all this stuff. You can they spend so much time in correcting all that. We have to take them 2 or 3 times just to approve one class or maybe one spring. But when we enter post graduation, later on, we realized that nothing, all of those things, all of those clasps or springs, nothing is relevant in this world, in this side of the world. Here, everything revolves around fixed orthodontics in layman language, which we call as braces. So, initially, when we enter post graduation, the first 6 months, again, we do this wire bending just so that we get feel of the wire, because later on also we don't have to do too much of wire bending, but this wire bending in the initial 4 or 5 months of post graduation helps in the overall understanding of the wire and makes us like faster. It helps us to adapt the wire inside the patient's mouth very fast, because we have already done the complex things. These are very complex things. The Adams class, or let's say UV, all that. These are very complex things. The complexity decreases, but the conceptual wise, we go much more deeper into orthodontics, of which we have no idea in undergraduation. So here in post graduation, we start from basic fixed orthodontic cases like spacing, crowding, okay, and then slowly we go on to complex cases like very severe crowding, or let's say impactions and extraction cases, distalization cases. Then there's orthognathic cases where, orthopedic
Skeletal
cases,
deformities and all.
like face mask, twin block, myofunctional cases. And if you have a very good surgery department in your college, then you can also practice orthognathic surgical cases. So a lot, I think it's true for all the post graduation branches that everything depends upon how good your branch is, not your college. Like in that college, how good is orthodontics or how good is oral surgery, and all of that. I think it's 60 to 70% depends upon your HOD. If that HOD is very good, then you will be learning a lot in post graduation. So in my experience in GDC Bangalore, my HOD was very nice. She was very good, and she let us learn everything. She gave us free hand, so we were able to do all these cases: impaction cases, extraction, non-extraction, crowding, even orthognathic surgical cases, all that. So in those 3 years, I learned everything which I am applying till now, even after 9 to 10 years of my post graduation.
That was a great insight, Dr. Aman. Now let me ask you a little bit direct questions which are really everybody wants to know.
Mm,
One is, you said you do a lot of spectrum of cases, काफी कुछ
mm,
सीखोगे, depends on the college. What, according to you, like, see, everybody does not end up taking GDC. Like, not everyone is
Hmm.
fortunate enough for like you to get rank one and get into the best of colleges. But yes, many good colleges in private sector also offer orthodontics, and they are
Right.
teaching nicely, I believe. So what, according to you, is the minimum criteria? Like, अगर एक BDS graduate when doing ortho MDS, whether government or private, is there any some we can say a line which we can say कि इतने cases तो करे होने चाहिए. This much work should have been done. Then only you will be ready to face the outer world.
Yes. So, sir, if I go back, maybe if I have given my post-graduation entrance test right now, and I have to select one college in which I want to do orthodontics among, let's say, a pool of 10 colleges. So I'll research, maybe I'll ask the seniors of that college that how many cases, maybe the final year seniors, that how many cases they have done till now. So in orthodontics, it's very easy to start, let's say, 100 cases, but it's very difficult to complete even, let's say, 60% of them. And we get to learn various movements as the case progresses, maybe till maybe after 2 years also. So minimum if the seniors have done 50 to 60 cases, so that should be good because out of those 50, 60 cases, they would have completed them 20 to 25 cases. And out of those cases, 10 cases would have been very good and they can keep it for their exams. In exam, we have to keep 5 cases, which should be like the minimum criteria. We
What
have
they
to
call
keep 5 cases.
debonded
Yeah,
cases.
and debonded cases, finished cases. So minimum 50 to 60 cases should be there. And if they have done, let's say 20, 30 cases, so that's not a very good criteria to select that college because
They
out of
should
those
have
20, 30
variety of
cases,
cases as well in that.
yeah, variety of cases, extraction cases, because simple cases anyone can do. In the first year, PG will also be able to close a space, maybe midline diastema. But like extraction cases, you start closure of space after 7 to 8 months, and then the space will get closed 1 year after that. So it takes around 2.5 years. So you will be learning that only if you have taken these complex cases early on in your first year or first year PG or maybe the starting of second year. So minimum this much cases should be the basic criteria when you are selecting a college. It's not necessarily a government college. There are very, very good private colleges. I was in Bangalore, and there are many good private colleges in Bangalore where students have done equal number of cases as compared to government college, or maybe a few more as compared to government college.
According to you, is there any specific characteristic or trait an orthodontist should possess to become successful like you in life?
Maybe first of all, you need a lot of patience because first, why patients, even the orthodontic patients, the cases, they go on for a very long time, minimum 1 year, 1.5 years. Then when you come out, when you are trying to search for patient, like for clinics, okay, when you have come out, you have just completed your post graduation. Now you're out, maybe you are from Delhi. Now you'll go on, maybe you have gone to a clinic of maybe Dr. Amit Lall, like keep me as a consultant orthodontist. But he's already having a consultant orthodontist, maybe Dr. Raman, maybe Dr. X. So he won't just switch from Dr. Raman
Sorry.
to you suddenly. Okay. So you need a lot of patience in finding clinics. Maybe in initial first month, you'll find one clinic, or maybe you'll find your first clinic after 2, 3 months, maybe 6 months. But slowly and slowly, then that change will start developing. That clinic
That is initial
will
struggle or
give you,
hiccup you have to cross
yeah,
through.
we have to pass through, but slowly and slowly you'll realize that once you start getting the hold of those clinics, then later on, maybe after 2 to 3 years, you need minimum 2 to 3 years after post graduation, when you will feel that yes, now I can, now I am satisfied that yes, I have studied 3 years, I've done post graduation. Now you can call yourself an orthodontist because you have started going to each clinic, maybe daily or maybe an alternate day.
Yeah, I remember conversation with Dr. Aman when he was a like I say fresh MDS pass out. I don't know why this word comes into picture. Like after MDS also you are a fresher. That's what the
Mm.
country calls. And
Yes, you
he
are fresher.
used to like I used to message him in the morning and he used to reply within seconds.
Yeah.
And I was like, why you are able, like, how you are able to reply so fast? He says, like, he used to say that in mornings are really free in those days. But
Hmm.
today, it's really tough to get appointment of Dr. Aman
No, I'm
at
always
many,
free for you.
many. Any, thank you for
Yeah.
that. But that is what
Hmm.
all these viewers should be learning. With time, you will become busy if you are good in the subject, if you have a good hand, if you are a sincere orthodontist, work will automatically flow with
Hmm.
time. So, Dr. Aman, like you said, there are many good colleges in India for ortho in private sector as well. So, but you know the private colleges charge a hefty amount when it comes to branches like ortho, prosto, endo, OS. So
Yes.
it's a lot of amount to be invested by MDS aspirants. So one query which we come across is it worth investing so much in a private college, asking say 10, 15, 20 lakhs per annum of fees? What is your say on return on such investment?
So if you can afford this much amount of money and the private college is very good, because I know personally my very good friends have done post graduation in orthodontics from various private colleges, and they are earning very well right now. And if that college, see, in that college, if orthodontic branch is very good, then you should take that branch, because later on when we pass out, if sir, let's say I know 20 doctors, maybe only uh, one or two of them had asked me earlier on that from which college have you done. They look at the overall personality of the doctor. It doesn't matter very much whether you have done from government college or private college, if you know orthodontics very well, and that will be reflected on in you if you have done very good number of cases.
The
There is,
confidence people speak. Yeah.
yeah, the confidence. If you have done 100 cases from a private college, okay, then you will be as confident as a postgraduate fresher, let's say, who has done from a government college. But in many cases, let's say 80% of the private colleges, I'll say, they do not have good number of cases, or the branches are not very good. The staff is less, or let's say the HOD is not interested to teach. But if you are in those 20% of good colleges, good private colleges, then I think it should be worth to spend that money, because later on it will take some time, as I said, minimum 2 to 3 years. But after that, you will feel that yes, now I started earning, and that money which I spent in PG, that I recover easily.
Yeah, that's really good. Like, see, as such, ultimately, if you are good enough, you are bound to earn money.
Hmm.
Maybe it will take, say, around few months, but like Dr.
Yes.
Aman said, पैसा तो कमा लोगे.
हाँ,
Okay.
पैसा कमा लेंगे धीरे
We
धीरे.
have been seeing Dr. Aman, I think in your days also, in my time when I gave exams and all, ortho used to be taken by top rankers, right?
Yeah, a lot.
And
Hmm.
till date also, it is very much more of an intellectual people are entering into that. So
Hmm.
as we see, dentistry has ratio of male is to female is like girls are more. In entrance, you have been teaching for almost 10 years now. Girls are topping the charts every year. I
Yes.
must ask you this, like, as there is a perception, ortho person has to roam around so many clinics for consultation, for earning money, for settlement and all. Do you think the branch has created some kind of a gender bias
Hmm.
somewhere?
I don't think there's a lot of gender bias in orthodontics. The challenge for a female in orthodontics is that, see, I personally travel to clinics which are as far as 50 kilometers from my home. So, like in Gurgaon or Noida, it takes me 1.5 hours
One side.
just to reach that clinic. And then there will be many days when you are not going to only a single clinic, when you have to travel to maybe 2 or 3 clinics. So you will travel 100 to 150 kilometers in a day. So that becomes challenging. If you are not driving a car, maybe you can have a driver, but there are many. I know everyone drives a car right now. There's
Still, you have
no
to be on
gender
road.
bias in that right
100 to
now.
150 kilometers in Delhi traffic is
It's too much.
unimaginable.
So if you are ready to travel this much, if you are ready to drive your car this much, then there shouldn't be any problem. There are many people I know who join colleges. I personally did not join any college. So if you are joining a college, then that is fine, because then you just have to travel to and so from a college. Yeah. But if you have opened your own clinic, then that's not a problem. But with orthodontics, the problem is we are limited to learning only in those 3 years of post graduation. We don't do anything apart from orthodontics, no cavity filling, nothing like that. So we are totally locked out from all those general dentistry work. So it's very difficult to do all those routine procedures like RCT and all in your own clinic. So if you are a female and you're like, in my case, my wife is endodontist, so she manages our clinic. She does 90% of the work. I just do 10% of the work, which is limited to orthodontics or
Ortho.
maybe some extractions. And in your case, if you are a female, then same way, if your husband is an endodontist, then he can manage his own clinic. Yeah, like your
So
clinic.
basically, you are saying orthodontist should marry endo person
Yes, they
anyhow.
should not marry ortho. Ortho should not marry ortho. They should marry either endodontist is the best branch for the all like
Settling down
general
thing. Yeah.
dentistry work, the crowns, bridges, RCTs, all that. So and we know that bread and butter is always we say is RCT, root canal and crowns, all that.
So after completion of MDS,
Mhm.
like you said, you have been doing what you have studied in those 3 years. You're doing variety of cases. You have upgraded your practice with Invisalign, becoming a certified
Mhm.
master in that as well. What are the more, you can say, avenues available for an orthodontist as the time passes by, like once passing out? Or is it restricted only to the branch of only braces? Like,
So initially, when I came, it was mainly braces. The aligners practice, it was just booming. Few aligner companies were there. Invisalign was there, but there weren't many orthodontists who were practicing Invisalign as compared to today. So in my practice also, I slowly, after 2, 3 years, 4 years, I started incorporating aligners. After 1 or 2 years, I started self-ligating braces, all that. Now initially, 9 out of 10 cases I did conventional cases. Now, 8 out of 10 is self-ligating braces. One is aligner, all that. So, aligner cases now, I think the future of orthodontics is going to be aligners. It's an Invisalign is one of those very good aligners, which I think I do only Invisalign right now. And future will be aligners, maybe 50-50, 50% basis, because the cost of the liners is such that all the patients cannot afford. So apart from orthodontics, there are certain people I know orthodontists who does implant practices also. They have done
I
good
was
implant.
about to ask you this. I have
Uh,
seen many orthodontists switching, or you can say adding up the implant practice to
adding up.
their.
So they have added up implants because they have their own clinics also. So they need to do some work in their clinic also, as I said. So they
And
started
they have a
doing
good
implants.
consultation network. I think that is one of the major front.
Yeah. So in implants also they can do consultations with orthodontics.
You don't have to
And
find
then,
new consultation for implants. You already have a system lined
yeah,
up
we
for you.
already have those clinics. So those clinics only they can call you for implants if they are not doing implants on their own. So people do call orthodontists for implants for uh, apart from this basic braces and alignment stuff also. So yes, there are scopes, and right now after like 3, 4 years back, liner practice was not so much. Maybe after 5 to 6 years, who knows? Maybe something develops apart from
New.
aligners also, and some new system has developed. But aligner practice is a good. It's a good. You earn good money through aligners and orthodontics, and I think the scope is good for all the aspirants who want to join orthodontics. Hmm.
So, Dr. Aman, like when a lot of MDS aspirants are students who get ranks in NEET and INI, they discuss what branch to choose. One very common question comes is, कि I have a very mediocre hand skill, had very mediocre hand skills during my BDS days. Well, I'm not extraordinary. I'm not Michelangelo or something. So, does like ortho will suit me in this regard?
So orthodontics require very, there's no complex. wire bending, all that, as I said in post graduation, okay, and even right now, you require very minimal hand skills in orthodontics. What
As
you
compared to
require
other branches like
as
ortho,
compared to
endo,
other branches, yes, also we need carvings and all, like root carving, proper, all that, crown cutting. There, these are all like delicate work which really require finishing
cons
up.
endo also. Yeah.
Pond window, very delicate work, fine canals, all that. Here, the hand skill work is very less, but here we like sometimes what happens is when we are doing patient and I am going to place a bracket, maybe I applied some torque, I have to apply some torque in the wire. So for 5-10 seconds, we just pause and just think like this कि कैसे करना है कि वो किस डायरेक्शन में मूवमेंट होगी, all that. So you just need simple, like, you require a lot of physics in orthodontics, more of conceptual work, and that conceptual theoretical work you have to translate in your uh, placement of brackets, selection of wire, which wire to place, when to place, how to place, all that. But wire, like hand skills, doesn't matter. Even I remember I wasn't able to make that cube in dental materials, all that. I was very bad in all. And in wire bending,
Yeah, I
it,
used to love ortho till date. I'm like fascinated with the branch. I always used to think it's more of analytical brain which helps in ortho
yes,
rather
a lot.
than
Hmm.
hand skills. But it was like it's better to listen straight from the master in the field rather than
You do not
putting on.
require very, you are like, you do not require an excellent or very good hand skills in this.
Basically, if you are an average clinician at BDS level, you can become a master orthodontist
Yes,
in
yes.
spite of being
Later
having
on,
great hand skills.
later on, I feel after feel, so you must have also experienced that the talent in your wire bending, all that. Okay, after few years, it doesn't matter how good you are in wire bending, all that. All that matters is how good you are able to, how you are like communicating with your patient. How good is your behavior with the patient? If you are able to manage the patient well, okay, the clinical point of work, the clinical work, that is just, हम कहते हैं ना 19-20 का ही फर्क होगा with you and maybe the next dentist. But if you are able to keep that patient happy, then that patient will, then you can earn more money for your own clinic, for the clinic where you're going for consultations, all that. So I think that is the most important thing later on.
So, Dr. Aman, one last question. After being in the as an orthodontist in India for last almost 10 years, if we send you back in time and you have to attend today's counseling session, will
Yes,
you, with the experience of almost 10 years, will you take ortho again or you will like to make a shift in your decision back in
I will,
time?
I will take orthodontics again with my eyes closed. Even if I am not getting GDC Bangalore or any other GDC this time, I'll select a very good private college. If I'm able to afford, then I'll definitely go in that private college. And after completion of my post graduation, I'll start finding clinics. I'll start, initially, we have to go through that rough time where you have no work, you're just out of college. And especially for government college people, because there you were earning stipend, you are doing hundreds of cases, and suddenly outside you are nothing. In
Zero
government
work.
college,
Yeah.
we feel कि हम तो बाकी colleges से हम तो बहुत आगे हैं. बाहर आके road में you will see that everyone is equal. And initially it will take some time, but later on, after 6-7 years, 5-6 years, maybe you will be the one who will be recording this video and and telling your journey.
So you are a satisfied orthodontist with your branch, with the specialty, and you want to ready to go through the ordeal again, in
Yes.
spite of being into this life once in past
Mm.
years. Thank you once again, Dr. Aman, for giving your valuable time. This is almost 10 o'clock right now in our country, and
Yes.
it's really thank you. I want heartfelt thanks again. This will really help. This video will make students take judicious decision about the branch,
Mm.
and that's like thank you again. That's I want to say.
Thanks. Thanks.